It's always a great pleasure on EASD TV to have the editor-in-chief of Diabetologia, Hindrik Mulder, with us. Hindrik, welcome. Thank you so much for coming to talk to us. So, how has the year been for Diabetologia? My impression is that it's been doing rather well.
I agree. It's been a very exciting year. We are keeping our position in the field, maybe even improving it a little bit. We saw a bump in impact factors a few years back, but then there was a downward turn. But we're doing quite well at the moment, so I'm happy about that. Still, I need to say that impact factors are not the most important parameter of a scientific journal. I think it's the rigor, it's the long-term ambition of the journal that counts. So that's really good. There's also been a lot of things going on behind the scenes, and I'm really pleased that we've been able to sign a new contract with our publisher. So there will be 10 more years of Diabetologia as we know it.
Hooray!
Thank you.
So, Hindrik, what have been the key papers, you think, that have come out this year? Because, again, my impression is that diabetes has become a very hot area of science at the moment.
I agree. And we publish an array of things in the journal. I think that's what makes us unique. We publish everything from molecule to cohort studies to care studies. So I think it's difficult to pick out anything in particular. And we welcome everything at Diabetologia as long as it's relevant for diabetes. I think that the consensus reports that we publish are really important because people are looking to them for, guidance when treating patients. That's really, really important. We've started to publish extended articles. The reason is that many of the high-profile projects today are really comprehensive studies, and they require a larger scope in order to publish, appropriately. And so we're providing that opportunity now.
And it's in a difficult time for journals. We've seen the rise of AI. How's Diabetologia dealing with this?
So we require our authors to declare whether they have used AI when they prepare their manuscripts. At the same time, I think AI can be very useful for journals as well. They can help us do a lot of screening, looking for plagiarism, etc. So I think we should keep an open mind when we think about AI.
Now, you're in a unique position, Hindrik, to see what the big science issues are in diabetes. Yeah. Where do you think those are at the moment, and what do you see as a coming wave?
So this, of course, will be a personal view in a sense. I think it's extremely important how we spend our resources on care for diabetes. So disparities in health, I think, are emerging as perhaps the biggest problem we have globally. Even with the tools and the resources we have now, we could do so much more if they were distributed more evenly. And there's a growing recognition of this in the community, in the field. So we need to work hard on that. So that's one thing, and that's maybe not science in itself. It's more of a societal issue. In terms of science, some of the drugs that are emerging, I'm thinking about the incretin-based drugs and the SGLT2 inhibitors, they have effects that were not anticipated when those drugs were developed. And many of those effects seem to be very beneficial, and we need to understand the mechanisms. I think we're just seeing the beginning of this. And if we can tailor drugs to some of these effects that we are now seeing, we can create very, very specific tools. And that's important because the patients are not uniform, they are heterogeneous. And sometimes this boils down to the term precision medicine. So if you can tailor treatment to the individual, you may be much more successful in treating the patients. So I think we're going to see a lot there. Having said that, and returning to health disparities, we need to make this available even to patients in lower and middle income countries. If we develop precision medicine and it's used for 2% of the global population, that's not fair.
Do you see the incretin-based medicines being used in a similar way to statins in the future? I mean, say decades hence, in order to prevent not just diabetes, but actually a whole range of other conditions?
I think it is possible, but I think it's important to understand how they work so that they can be refined, so that these molecules, these peptides, what have you, that they can act in a more specific way, because then you can use them more specifically. So if an individual has a weight problem, then you use a tailor-made incretin-based drug. If it's cardiovascular problems, then you make it different depending on the knowledge that has been collected. So I think there's a fantastic opportunity here.
The scientist in you, what makes your heart beat faster at the moment in terms of the science that you're seeing? What's the really exciting that's coming up?
So again, this will be very focused because I'm a beta cell islet researcher, at the core, and I'm seeing a new wave of research in that area with the stem cell based islets that are now being used in at least proof of concept trials. I think 5 or 10 years down the line, there will hopefully be therapeutic opportunities in that area, which would be just amazing.
It's very significant, isn't it, that the JDRF is rebranding itself as Breakthrough Cure Type 1 diabetes. And we are talking of cure in a way that wouldn't have been possible even 10 years ago.
Absolutely. And this is just amazing. And you can use these tools not only to treat patients, but also to model disease and develop new therapies, find new targets to treat. And that's what we are doing in my own lab. So the opportunities here seem endless. And when I started out in science, if somebody had told me that you can take a skin biopsy from a patient, reprogram those cells into a stem cell and then make beta cells from those, I would have laughed. I said, that's science fiction, will never work. But we're doing it at the moment.
Finally, what are you looking forward to on this year's EASD 2024 programme?
So I am very proud of the symposium that we have created for Diabetologia. And it's about technology in diabetes therapy care. That's perhaps not unique, but what we've done is that we've involved patients. They have been so helpful. It's been so enlightening for us to have them on board and guiding us in this process. And I think there will be some surprises at that symposium. So I really encourage people to come. It's on the last day. It's the last afternoon of the EASD. Not the best time point in the program, but it's going to be a very exciting symposium. And if you can't make it to the symposium, download the special issue, which is also very nice. And it features patients living with diabetes.
Thanks so much, Hindrik. It's always such a joy to talk to Hindrik Mulder, and he has previewed the Diabetologia session on technology. Please go and see it, and also have a look at that special issue of Diabetologia. Bye for now.